When you hear the word cancer, what's the first thing that comes to mind? Probably things like chemotherapy, doctors, the physical fight, right? But there's this whole other battle that happens in the quiet moments, the loneliness, the fear, the isolation. That's what we're diving into today. The rise of digital communities that have become an absolute lifeline for patients. We'll look at what makes them work, and maybe more importantly, what's holding them back.
Getting a cancer diagnosis, it's not just a medical event. It completely turns your world upside down. And with that comes this profound sense of being alone, this deep anxiety that, honestly, our traditional healthcare system just isn't built to handle. That's the unseen struggle we really need to talk about.
And look, this isn't just a feeling. The numbers are staggering. Cancer patients face a risk of depression and anxiety up to 4 times higher than the general population. Just let that sink in for a second. On top of fighting for your life physically, you're 4 times more likely to be fighting for your mental health too. It's a crisis hiding in plain sight.
So you'd think with a need that huge, the support would be there, right? Well, here's where it gets really frustrating. Only 10%, just 1 in 10 patients actually gets the formal psychosocial support they desperately need. That means a staggering 90% are left to figure it out on their own. The system is failing them.
So that begs the question, right? When the system lets you down, when you feel completely alone, where do you go? Where can you possibly turn? Well, for millions of people, the answer wasn't in a clinic or a support group down the street. It was online.
And that's where we see this incredible new thing emerge, the Digital Lifeline. We're talking about virtual communities. These are online spaces that have basically bubbled up to fill that huge gap we just talked about. They offer support anytime, day or night, no matter where you are in the world.
So what are we actually talking about here? It's simple, really. Think of it like a support group that's always open, right on your phone or computer. It could be a web forum, a private social media group, a dedicated app. Whatever the form, it's a place where people who are going through the same thing, patients, survivors, even their families, can finally connect, share what's really going on, and, find some real strength together.
And the benefits, they're huge. It all kicks off with one simple, powerful thing: connection. Suddenly, you're not so alone. You're talking to people who just get it. And from there, it's like a chain reaction. Your emotional well-being gets a boost. You start to feel more resilient, more in control. It actually empowers you to take a more active role in your own treatment. It's an incredible ripple effect.
Now, this quote gets at something really important. The secret sauce, in a way, is anonymity. Think about it. It can be incredibly hard to talk about the really tough stuff, your deepest fears, embarrassing side effects, family drama, with people you see every day. But online, behind a screen, that little bit of distance makes it so much easier to be completely open and honest. It creates this safe little bubble for the raw conversations that are absolutely essential for healing. Okay, so this all sounds amazing, right? A perfect solution, but it's not quite that simple. As powerful as these communities can be, there's a flip side. There are some really big hurdles that are stopping them from being everything they could be. So let's flip the coin and look at the reality of the situation.
So here you see the fundamental tug of war. On one side, you have all this incredible hope, peer support, empowerment, finding your people. But on the other side, you've got these harsh realities. People just aren't sticking around, huge groups are being left out, and there's a major disconnect from the actual healthcare system. It's the promise versus the reality.
And let's start with what might be the biggest gut punch. Check this out. Almost 2/3 of new users, 62.5%, they log in one time and then they're gone. Forever. Just think about that. People are reaching out for help, and for whatever reason, the platform fails them on day one. How can you build a community when most people walk in the door and immediately walk back out?
Then there's the question of who's even in the room. When you look at the demographics, you see this massive gap. These communities are overwhelmingly used by women. That means men, older folks, people living in rural areas. They're often left on the outside looking in. This digital lifeline isn't being thrown to everyone who needs it.
And the problems don't stop there. There are other big systemic issues. For one, most of these platforms are totally static. They don't change as a patient's needs change, from diagnosis to treatment to survivorship. Then you've got the whole digital divide. Not everyone has easy internet access or the skills to use it. Plus, they're siloed from hospitals, there's a real danger of bad information spreading.
It's basically a perfect storm of challenges. So after hearing all that, you might be feeling a little discouraged. But here's the good news. The research doesn't just point out all the problems, it actually gives us a roadmap, a kind of prescription for how we can do better. It shows us how to build these digital spaces to be stronger, safer, and way more effective. So here it is, a 4-step plan for improvement. Step 1, design platforms that can actually evolve with a patient. Your needs are different when you're newly diagnosed versus when you're 5 years out, right? The platform should reflect that. 2, we have to get serious about inclusivity. That means designing with diverse groups of patients, not just for them, and creating options for people with slow internet or who speak different languages. 3, we need to bridge the gap between these online groups and the actual doctors and hospitals. They shouldn't exist in 2 separate universes. And finally, number 4, prioritize safety. That means real moderation to protect people from misinformation and distressing content. When you put it all together, this is the ultimate goal. This is our North Star. It's not about just slapping up another online forum. It's about building a truly dynamic, inclusive, and safe digital support system, one that adapts and grows with the patient, a system that doesn't just passively watch their journey, but actively helps them navigate it for the better. So yeah, the potential here is absolutely massive, but the challenges are just as real. It leaves us with a really big, important question to think about. How do we actually build these digital spaces so that they can truly heal, so they can connect and empower every single person who needs them? And make sure that this time, no one gets left behind.